I've been here for a little more than a year, really impressed with the history and the current drive that our professionals have to really serve their community. We are trying to transform lives through hope, through health, and discovery. What does that mean? We're the region's only academic health system. And so we have a very particular mission and a type of professional. We want people to look to the University of Toledo and its clinical enterprise as a place where they can come to get help, to have their hope to get better, to grow, to heal, served. Through health, we obviously have collected a large array of professionals, whether they're healers, teachers, researchers, from all different disciplines working together as a team to deliver you answers.
So, in some of your early interviews for this role, you said that healthcare is a team sport. What does that look like at a university-based health system?
I think we are a team sport because in this complex world we live in, it used to be the right answers always came from the top. Person with the most degrees, the most titles. That's not true anymore. There's so much going on and so much interconnectedness of what we're trying to achieve. Any member of the team can have the critical insight, and you want a safe environment where they can come forward with that insight to say, I think I have something we should work on. So we really need that variety of backgrounds, of trainings, disciplines to do what we do.
Absolutely. So, what do you think our greatest healthcare needs are in our region right now?
To be frank, there are some challenges. Our region, if you look at our home county of Lucas County, it has some challenges in health. Recently, an external survey that looks at community health across the countries in various counties. In Ohio, we score 79th out of about 88 counties.
Ooh, that's not good.
And that's not the good direction to score. And so how do we start to attack that? So we have really kind of the highs and lows. We have the best of most innovative care, nation-leading care in some respects, and other times, right around the corner, you also have these pockets. So how do we address a community health?
Sure.
And so I think that's really a focus. On the broader range, we know that there are areas where people don't have as great an access to care, particularly primary care.
Sure.
Preventive primary care, the things that take their toll over time, hypertension, diabetes, weight management. These are the kind of chronic conditions that left untreated shorten our lives and manifest as things like strokes and heart attacks. So how do we intervene earlier?
Sure.
Yeah, and I think that's part of our charge.
Well, that's great. All right. So what opportunities do you see when an academic medical center fulfills its tripart mission of clinical care delivery, education, and research?
I think it can be truly powerful, and it attracts a special kind of person who wants to be in that environment. So it's self-perpetuating.
Sure.
As you get good at it, you bring people who will help you even get stronger and as a site to apply their trade. I think a good example is our transplant program. I mean, we have a nation's leading transplant program. One of the interesting features here is we have really the shortest wait time in the country still, roughly 6 weeks from the time you're listed till you get a transplant compared to a national average of 3 years. And then the research, future state is we may be able to literally grow some of these organs that we need.
That's incredible.
Which would eliminate shortage. So I think that's just one example of that power of that tripartite mission, but there's many examples.
Sure. And that everything you just spoke about happens right here. To think of the thousands of graduates that came from the Medical College of Ohio and now are rockets, we still serve that mission.
Absolutely.
Of, enter to learn, to go forth to serve. And one of the things that I learned that most of the clinicians who are teaching, they have the philosophy of see one, do one, teach one.
So alumni have pride in those things. They also want to know that it's not just the past, it's the future. Are we taking the gifts of the past and of the present and investing them in a way that will keep this strong going forward? And I hope to think that what we're doing is contributing to that. The ability to do something new, something novel, something that's going to set the next generation of what this place is about. I think that's where the most exciting action can come in. And that I think donors would like to learn about and participate maybe in some way that fits with their own objectives.
Absolutely. I am very much looking forward to working with you on securing resources to be transformational for our community and beyond.